Hi guys. Let's continue our lecture. So with this portion, we are going to look into the synovial joint. And we know that synovial joints is the one to allow the movement. And so that's probably the most important part uh, for you guys, for us, to have good knowledge about how they do the function and how to prevent the injury, right? Um, and so, because there are so many different type of movement, uh, we can look into them and to look into how does this joint, how is that arrangement to make different movement. This is some of the joints can move in only one direction. Some of the joint can move in two direction. This 3D world, two axis, one axis, two axis, or three axis, right? So what is the difference? Uh, and so all together we can further classify the synovial joints into six different types. So right here, so it could be the structure. This is most like obvious one that we learn in our skeletal system. Uh, we have the ball and the socket. Does it ring the bell? Like what one structure you have this ball is called head. We have this femoral head right here, femoral head or femoral, not femoral, humerus head. Femoral is the same thing. Femoral also have the head and that put into the socket right here. So in this case, like humerus head, glenoid cavity in a way that take that humerus head, and so you can have a lot of flexibility. So this is most flexible, largest freedom of movement. Yeah. So you have the uh so glenohumerus joint, for example. He's in the scapula and the femur. Uh, Another type is called plane. So plane is these two joints. You need to remember we didn't draw you the synovial, but it's inside of synovial. All right, all these joints are inside of synovial. So it's very fascinating that it's not just bone, it's not just muscle. It has this fluid like space. So this joint is in the fluid space. Yeah. All right. So this is the plan. So with this one, this example is the scapula again. Here, scapula has two process. Here is the acromion process, and that attached to the clavicle. And so with this joint, it allow you to have the sliding, right? And so right here, plan. Another one is right here. It's called pivot. So with this one, you have a bone has a create a little bit like a dimp, and then the other bone put in into that dimp, and so it allow you to have rotate. So with this one, you can rotate. This is part of the elbow, but it's not the elbow like for this. This is allow you to have what like this, right? You can rotate. You can rotate. Yeah, you can rotate like that. Yeah, so you can rotate. Ulnar radius, you can rotate. Yeah, that pivot. So here is the proximal radial ulnar joint. Another one, this is hinge. So hinge also provide you freedom of movement, but usually it's only one direction, one axis. This is the elbow exam. Example is the elbow joint right here, elbow joint. So you have, so so remember elbow joint that here we have that process. So you can not move further. Do you remember that process? This is the humerus. Humerus has that process in the back right here. What's that process to prevent you from moving further? Yeah. Do you remember that? So do you remember? All right. So that's that. I guess you don't remember. I put a picture right here. So here is that. All right. So right here. So humor, humor. So humor cannot moving further down is because here the what's that? The owner has that process. So this one is the we call this part is called trochlea. Trochlea is like hinge, right? It can rotate. It's not like head. Head is very much like head. It's also uh articular cartilage on top of it. It's very much like a head, but they only move one axial, one direction. Yeah. Two direction, but one plane basically. Yeah. So it got stopped right here. Olecronon right here. Olecronon. Yeah. And the medial condyle right here. Yeah. So that's that. Humor, ulna. So this is kind of like the hallmark of the ulna, right? And then the front, you have two process. One is in the back, olecronon, and then one in the front is called uh, coronoid process. Yeah. So that's a hinge, all right, hinge, yes. Another one is called saddle. So it kind of like like a saddle on it. Yes. Yeah. So, you can have a one direction and the other one has the other direction. Yeah. So this is between the carpal and the metacarpal joints. We also have something called condylar. Condylar is very much like in your finger, metacarpal and phalange right here. So this is also synovial joint. I just twist my joint like several months ago. It's very difficult to heal. Yeah, maybe I'm old. Yeah, so that's that joint. Yeah, condylar. So that's that. Because of their arrangement, they have different range of freedom to move. And then from here, I want to go back to about the movement. This is very anatomical lecture. So before that, let's just summarize what we just learned. We have plane joint, so it allows the gliding or sliding, gliding movement. Acromial clavicle joint. Hinge is the one that is the elbow, right? Elbow, yes, elbow. Flexion, extension, pivot, pivot, pivot joint. It allow rotation. Uh, Proximal radial ulnar joint, condylar, uh, like radial condyloid, radial carpal, or our finger, like phalange, meta, what's that? Metacarpal, yes, metacarpal phalange, condylar. Yeah. Saddle, is like carpal, metacarpal joints, and the ball and the socket. So this is a famous one, like humerus head and the femurus head, right? You have shoulder, you have your hip. So yeah, it allow more flexibility to more freedom to move around. So with this one, I want to go back to a little bit, like remind you guys, we mentioned about it in our very beginning, and that's because now we learn we go back to review what kind of movement of this joint allow our body to have that, and those involve different definition of such as extension, flexion. So let's take a look. So here is a type of body movement. We show this picture in our very first lecture, the anatomy overview. So you can see that we have the abduction, uh, working in the like coronal plane abduction and adduction, add together, come together, adduction. Or you can have a flexion. This is the sagittal plane. Adduct, flexion, extension. Yes. You can have your arm, you can have your leg. Flexion, extension. You can have shoulder rotation, backward rotation, shoulder depression, elevation, your leg, your sole, right? Your feet. Uh, plantar plantar flexion, dorsal means back, flexion, plantar means this side, plantar flexion, dorsal flexion, uh, eversion or inversion, outward, inward. Uh, your this flexion is right here, extension, we learned that already. We have the leg for the adduction. We have our spine or spine or vertebra flexion, lateral flexion, extension. We have rotation. This is all spine. And then we have our leg rotate externally or rotate internally. Yeah, so those are uh, the movement. In the quiz, I can just take a picture and then ask you what kind of movement is that, right? So many questions right here. Easy for me to quiz you. Yeah. So here is in of the reduction or adduction is in the front plant. All right, that's another way to say it. Front plant. Front plane. And the abduction is away from our longitudinal axis. Adduction is coming back. Yeah, coming back. Finger, the same thing. Away, so it's abduction, coming back. Adduction. Yeah, this is our wrist coming back to our body. Is yeah, right here. What's that? Abduction, above, away, adduction, coming back. Yeah. Flexion extension is in the more like in the sagittal view. Yeah. So you can have a head extension flexion, your spine extension flexion, your arm or your hand arm basically flexion extension, your leg flexion extension. Yeah. Your wrist too flexion extension. Yeah. Be concerned about the angle of the joint right here. What do you say here? Angle between the bone and the joint. Usually, if it's less reduced, it's called flexion. If it increased, it's called extension. Yeah. Rotation easy. Just rotate. Yeah. Left rotation, right rotation. Rotation like no. Yeah. Say no, 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 no. In the limb, we can also have rotation. Yeah. Internal rotation, uh, or medial rotation, or external rotation, or lateral rotation right here. Rotate back. Internal rotation. Rotate out. External rotation. In our hand, arm, basically arm, we can have a pronation. Pronation is this. Supination. Yeah. Pronation. Pronation. Supination. Supination. Let me show here. So here is supination, supination, pronation. So you can see that here, your ulnar and the radial basically it's allow the joint to rotate. Yeah. So the way to people think about that is like this is like you're holding a soup. So this is supination. And this is opposite, so pronation. Other movement, you can have your foot inversion, exversion. You can have your this one talk we talked about that already. Dorsal flexion, plantar flexion, dorsiflexion, plantar flexion, lateral flexion. We talked about that already. Lateral flexion. You can have your jaw, right? Depression, elevation. This is your this one is called opposition. Okay, okay, yeah. This is a jaw again. Protraction or retraction. Yeah. So so that's that. So that is the movement. All right, just a little bit quick review of all this movement. The next one we are going to look into specific examples of the joints. And all right, so let's take a break and we come back to examples of the joints. Yeah. See you next time.